Let's begin our section 3, in which we will talk about the puerperal disorder. What are the different disorders that are associated with the puerperium, which is the time period from the delivery to about 6 weeks after the delivery. So puerperal disorder, which we will discuss in this section, will be secondary postpartum haemorrhage. Then we will also talk about the pelvic infections that can occur in the puerperium and also puerperal sepsis. So puerperal disorders include, first is the hypertension, which is very commonly associated with the puerperium. And if the on the postnatal visits or immediately after the delivery, it's noticed that the blood pressure is high and that blood pressure is not coming down. It should be taken seriously because it can cause postnatal eclamptic fits. Eclamptic fits can also occur even after the delivery if the blood pressure is high. And also good monitoring of the blood pressure and good diuresis, and the urinary outflow should be good to reduce the fluid volume, body volume, so the blood pressure can be managed and controlled. An intake of antihypertensive. Antihypertensives are the drugs used for treating the high blood pressure, and usually labetalol is used for that. If the blood pressure doesn't come back to normal, it is important that patient should be hospitalized or should not be discharged until the blood pressure comes back to normal. Then the other puerperal disorder can be obstetric palsy, which can be neuropathy of limbs, palsy of the limbs, and then sciatic pain, paresthesia, and hypoesthesia. All these can occur. Sciatic pain is usually the pain that goes from the back all the way to the toe, so it's common after delivery also. Paresthesia, there is loss of sensation, and then there is also lack of feelings and sensations. So paresthesia and hypoesthesia is common. Then peroneal nerve palsy due to nerve compression. Peroneal nerve palsy can also occur due to compression of the nerve. Urinary and fecal incontinence. We already discussed the effect on the bladder and the bowel, and both can have urinary and fecal incontinence. There is formation of the fistula, and there is incontinence. Then the symphysis pubis diastasis is another puerperal disorder which occur 1 in 800 vaginal deliveries. There is a diaphysis due to pressure, due to abduction of the legs. All these can lead to symphysis pubis diastasis, linked with forceps delivery and thigh abduction. Weight bearing, tenderness and pain. Usually there is pain and tenderness. It's a weight bearing joint, so the symphysis pubis diastasis can lead to very bad pain on the hip bone or on the pelvic bone. So this is common after, especially if the forceps are used. We need more abduction, more space for the delivery of the baby with the forceps. So this is common after that. Rest and anti-inflammatory drugs are used for this, and also physiotherapy is recommended for this. So all these are common puerperal disorders that can occur after the delivery. Secondary postpartum haemorrhage. Fresh bleeding from genital tract between 24 hours and 6 weeks after delivery. We already mentioned about the lochia, which is the discharge, so along with the necrotic tissue from the decidual site. But besides that, if there is fresh bleeding coming out after the delivery, and especially after 24 hours of delivery up to 6 weeks, which is the period of the Puerperium, usually it means there is secondary hemorrhage occur and there is secondary infection takes place, which can lead to postpartum hemorrhage. So that's the postpartum hemorrhage. Due to endometritis or retained placental tissue, endometritis is infection of the endometrial lining of the uterus, or if there is pieces of placenta retained. It's very important that after the delivery of the placenta, we should look the placenta and check if the placenta is removed as a whole or completely, and if there is no piece or no piece of placenta is retained in the uterus. So that can also cause postpartum hemorrhage. Here you can see this is the blood from the vessels of the placenta. So this is the hemorrhage. Endometritis is when there is endometritis suspected, there is closed internal os, tender uterus is present with the endometritis. But when the placental tissue is retained, usually the os is open. Os do not close if there is placental tissue present in the uterus, but in case of infection, the os is closed. And the uterus is larger than the normal, regression is not taking place, involution is not taking place, so it's larger than the normal. Signs and symptoms of secondary postpartum hemorrhage: we have low-grade fever, pungent lochia. This lochia is, it smells foul, foul-smelling lochia is present with the postpartum hemorrhage or infection. Uterine tenderness is present also. So these are few signs and symptoms associated with postpartum hemorrhage. Genital tract infection or puerperal sepsis. Genital tract infection following delivery is referred to as puerperal sepsis and is synonymous with older description of puerperal fever, milk fever, and childbed fever. So all these are the different terms used before, and they are the same terms as the puerperal sepsis. Etiology, what is the cause, is due to mixed flora causing infection, sepsis, when the infection reaches the bloodstream, and it is usually due to E. coli and Staphylococcus. Prevention is good hygiene is very important. All the instruments which are used should be clean, properly sterilized. Good hygiene is important after the delivery also. Cleaning of the perineum, cleaning of any episiotomy which is done. So good hygiene is very important. Good surgical approach, use of aseptic procedures, hand-based hand rub use, clean using of alcohol to clean the hands is recommended, and prophylactic antibiotics to prevent any infection and sepsis. So all this is recommended. So we have genital tract infection following delivery that occurs is referred to as the puerperal sepsis. Screening tests should be performed to find out the causative organism. So we should do the culture and sensitivity test. So it should be treated properly with proper antibiotic. Clinical presentations are chlamydia trachomatis leads to puerperal parametritis, delayed presentation, severity and clinical course varies. Investigation and abnormalities. What are different investigations that can be performed and under what conditions? Full blood count should be done if patient is suspected to have anemia, leukocytosis, thrombocytopenia, urea and electrolyte if there is fluid and electrolyte imbalance, culture of blood or swab from high vagina or infected wounds, bacterial growth, pelvic ultrasound, retained products, pelvic abscess. Clotting screen is done if there is suspected DIC, disseminated intravascular coagulation, blood lactate test if there is acidosis, arterial blood gas if there is acidosis, and hypoxia. So all these are the different tests that should be done if these conditions are suspected, or if these abnormalities are suspected, which is mostly the retained placenta, DIC, acidosis, hypoxia, and different infections. Next, puerperal pelvic infection. The signs and symptoms of pelvic infection. There is, as with any infection, fever, headache, malaise, rigors are common. Abdominal discomfort, vomiting, diarrhea. If there is offensive lochia, pyrexia, and tachycardia. Secondary postpartum hemorrhage, and uterus is large, boggy, and it's not regressing as it should be. So all these are different signs and symptoms of pelvic infection, which is very common after delivery, especially if the episiotomy is performed, and it is common after cesarean delivery. And if there is fever, malaise, and tachycardia, nausea, vomiting, these are all the indications that there might be infection present. Also, continuation of the signs and symptoms. There should be infected wounds present also. There is peritonism. Peritoneum is sensitive, inflamed, and peritoneum is the lining that covers the abdominal structures and abdominal organs. When there is infection in the genital tract, then it can reach to peritoneum and it causes peritonism. Paralytic ileus is also present. There is paralysis of the intestine and parametritis, infection of the surrounding tissue, and then there is abscess present in the pelvis. All these are also associated with pelvic infections. Next, let's talk about diagnosis and management of puerperal sepsis. And in this, we will talk about what are the different symptoms if present, how we should diagnose, investigate, and then manage that patient. So if there is cough present and there is purulent sputum, if the sputum is the secretions which comes from deep from the lungs, and if they are purulent or if it's pussy, it means there is some infection present. So dyspnea is difficulty in breathing. So all these, if they are present, it means the patient might have pneumonia. Unless there is a test done and it's investigated, the only thing we can think is the differential diagnosis only, but the diagnosis that comes to the mind with all these symptoms is the pneumonia. And then it's investigated by sputum microscopy and culture and sensitivity of the sputum and chest x-ray to look for the pneumonia changes present. Management is physiotherapy and antibiotics. If there is sore throat, cervical lymph adenopathy, usually the diagnosis is tonsillitis, and then investigation is throat swab and antibiotics should be given. If there is headache and neck stiffness, meningitis is the diagnosis. Lumbar puncture should be done, and then antibiotics is given. Dysuria, loin pain and tenderness, pyelonephritis or infection of the kidney pelvis, renal pelvis. Again, urine microscopy, culture and sensitivity, antibiotics and increased fluid intake. If there is secondary postpartum hemorrhage, tender, bulky uterus, then the endometritis or retained placental tissue is recommended. The clinical diagnosis we can do by the pelvic ultrasound, antibiotics, and uterine evacuation is performed. If there is cough, pain, tenderness, the diagnosis is deep vein thrombosis. Investigation is Doppler venogram of legs, and the management is by heparin. Chest pain, dyspnea, pulmonary embolism, chest x-ray, blood gases, lung perfusion scan, angiogram is performed, and the treatment is also heparin. Heparin, these are the blood thinners, and they avoid the clotting and thrombus. So painful engorged breast, mastitis, breast abscess, clinical examination, microscopy, culture and sensitivity of expressed milk, and again antibiotics, incision and drainage. So it's a very, very comprehensive chart that gives you all the information about what should be the symptoms and present, and how we can diagnose, and how we can investigate and manage. So this is all very important regarding the puerperal sepsis, the diagnosis and management. Management, again, broad spectrum antibiotics, as you saw in the previous slide, that antibiotics were used for all those cases or all those diseases, because it's the sepsis, puerperal sepsis, antibiotics. But the good strategy is to do the culture and sensitivity and then begin with the antibiotics. So we should give the proper antibiotic that is effective against the causative agent. Resuscitation with IV fluids, necrotizing fasciitis is rare. Management of shock, debridement of necrotic tissue is performed. And then split thickness skin grafts are performed if that is required. So all these are again the managements. If there is necrotizing fasciitis, which is rare, but then split thickness skin grafts are performed. Next, some other puerperal disorders include the thromboembolism can occur, which is risk rises 5-fold after pregnancy, mainly in the perineum. Prophylactic heparin injection or anticoagulant therapy is used for this thromboembolism. Compressing ultrasound or lung scan. Puerperal pyrexia fever also occur in this, in which we have 38 degrees Celsius or higher temperature combined with tachycardia. We should investigate that. As we talked in detail, the cause of pyrexia in the puerperium is the infections or sepsis, so it should be properly investigated and treated. Vaginal delivery, no infection, C-section is associated with infections. Chest complications appear in 24 hours after delivery, atelectasis with fever, aspiration pneumonia, hypoxia, and dyspnea. Chest complications can also occur after delivery, usually aspiration pneumonia and decreased supply of oxygen, hypoxia, and difficulty in breathing is present and usually occurs 24 hours after delivery. So this was all about section 3, in which we talked about puerperal disorders in detail. Thank you for watching sqadia.com.